Hi everyone, here today I'm interviewing Fit to Function Jess and Mel. We're going to see what they're doing business-wise, maternity related and everything else. So you've got both ladies offer physiotherapy for women, but what does that even start with? What does that even look like? It's a bit of a broad term, but if you wanted to try and explain.
It is a little bit of a broad term, but I suppose particularly if you take a look at women in their life stages, there's certain times where concerns and ailments can pop up, and we 100% specialise in that, I suppose.
Yeah, we're working with people from birth all the way through their lifespan. So from pediatrics, with checking head shape and hips and feet and all of that, as well as normal milestone developments for how they move and all of that jazz, as well through pediatrics for just growing pains and issues with sporting injuries as well, and even things like constipation is something that we deal a lot in too, and then into adolescence as the hormones hit and puberty's rearing its head. We can help with painful periods, difficulty with using like period products, all the way through to painful intercourse as well, and then all the way through adulthood and everything that we deal with having children, not having children.
Yes, just being a woman.
Yes. Yeah.
First though, we'll start with how do we get in contact with you. So some of these problems that you've already said sound like there's possible referrals from just a GP to start with, but what can we do? Like if I know something's happening down there and I need some help, can I just call you? How do I get in contact with you?
Absolutely, you don't need a referral to come and see us. And we all know as parents, sometimes you feel like you're left trying to navigate this health system to figure out who can help with what. Give us a call, book online, check out our socials, and that'll sometimes answer some of your questions. We really try hard to get a fair bit of our education out on socials for that reason, that we kind of tick a lot of boxes that a lot of general physio practices don't normally.
The self-referral, so I get in contact with you and say I don't know what's happening, what's going on. What does that lead to?
You offer just free discovery calls, so we just jump on the phone with you 5-10 minutes, what's going on, and then we can say, yeah, just come in for an initial appointment, or like I think you're best to get a referral to XYZ and come and see us along that journey. So we have that as a free option. You can book that online or call our lovely admin front desk and they can organise that. Otherwise, just book an initial appointment and we will go through, we will ask you more questions than you think we're going to ask about, and we can get that good sort of full picture of what's going on. And again, because we're frontline like allied health, we can say, right, we need to bring in this specialty, or we need to look at this, or actually we're well all over this ourselves, and we can help you through it.
And so with the public hospital, so you obviously can go down the public hospital for a physio, but they have a ridiculous wait time at the moment, I think. So what is your books looking like? How open are you to taking new people?
Oh, we're open. Yeah.
And that's something that we watch really closely in terms of making sure that we can service as well as we can. So, when the time comes that somebody feels, we come up with options. Like we have quite a few groups where we can offer group therapy sessions. We have allied health assistants so that we can help with load in that way, and then we hire when we need to. So it is a service that we continually want to build. So I don't want anyone to ever think we're going to have massive waits on our books. That's something that we really manage from a business perspective. In terms of booking an initial, just come and blurt it at us. That's probably what we have majority of the time. We don't need to. We have an intake form that we send out, but so often I have women particularly that sit there and are like, so this is happening, and is it normal? That's, I think, a lot of it is like, this is happening. I started to float it in mothers groups, and I just sensed a little bit of like this isn't going on with all of you. So blurt it at us and we will ask the rest of the questions. You don't need to know the whole picture. That's our job.
The age groups then. So when we're looking at pediatric, let's look from day one. So we're looking at newborny kind of baby stage. What is something you're getting common of, or something that people don't think maybe of?
That sort of fall under my work is like the head and neck, so you know your torticollis and things like that, where Bob's really quickly gets a bit of a preference to one side, and they can really quickly get a flat spot on their head. So we can help identify that and give you strategies to assist with that. Hip checks as well, and sort of also help just demystifying that process about where we need to go with things. And then just having a quick look through the legs and the feet as well, just to make sure like we don't have any of our like toeing in and things like that as bobbies. And then as well, just normal developmental milestones. So if you're not sure, if you're a bit worried, you know, your blue book says they should be doing X, Y, Z, we can do a developmental assessment, and we just see where they're at. A lot of the time it is just reassurance that there's a big range of normal, and then there might be a few little tips and tricks, and then all of a sudden they're off doing the thing.
And then we move further up into pediatrics, so then we're looking at our older children. We've already kind of talked about the adolescence and their puberty and everything, but I feel like there's a stage in between that, so a child stage.
A lot of growth and a lot of load. Like the kids are doing so much sport nowadays, and so a lot of the time it's just load management. I'm the last thing on my priority list is to say no sport. I do everything we can to keep them going, because I know that grade 2 athletics carnival is the priority number 1 for them. So I try and keep them doing as much as possible while manage that. But growth sort of issues as they're just shooting up. The body's trying to keep up is a really common one, as well as, you know, like they fell, they rolled their ankle, they've, you know, woke up with the stiff neck and they can't turn to the side.
Now we're going to the next stage pretty much, which is prenatal. One of the biggest things is pelvic floors. Pelvic floors, I feel like, are a very underestimated thing when coming into womanhood, labour and all the bits and pieces. So do you want to tell me what that is and why I should be actually concerned about that?
Absolutely, and it really is, it's like a part of our body that we've never even thought of before you fall pregnant. Sometimes before you're postpartum, you're like, what actually happened to this? It's a what? But there's so much that we can do. So your pelvic, when we talk pelvic floor, like we have muscles involved in the pelvic floor, we have what we call fascia involved in the pelvic floor, and then ligaments and whatnot. And so it's pretty much like connective tissue, tendons, ligaments, and muscle that literally forms the floor of your pelvis. So I don't know, I often say maybe a design flaw with us being bipedal and having a hole at the bottom of our body. Like we've got to have a fairly decent structure to be able to hold everything in place and hold everything inside. And then we're going to go and push a bloody watermelon at it. So then we have a giant hole at the bottom of our torso. So we just make sure that we stem any dysfunction there. We do the best that we can in that birth prep period. So that's probably one of the biggest bodies of evidence we've seen come through our industry, like our niche, in the last 3 to 5 years, is how much impact we can have on birth and the integrity of the pelvic floor throughout birth. So doing things like perineal massage so that we can reduce the risk of a high grade tear. So, you know, majority of us are going to tear to a grade 1 or a grade 2, and that's okay. We heal quite well from those. What our biggest risk is long term is those grade 3s and grade 4s, and our perineal massage is so protective of those higher grade tears, which is really exciting, and it's been really great to see data come through about that. Our pelvic floor muscle training is one of the most protective factors for pelvic floor trauma throughout birth. I can't actually think of the stat right now, but when we say pelvic floor training, we don't just mean ramping up. We need the muscle to be able to function, and so function means it needs to be able to contract, It needs to have a good resting tone, and it needs to be able to relax and get out of the way. And it has to get out of the way of that watermelon when we have that baby. So we actually teach that. First of all, we assess it. Some of us are good at it, and some of us really suck. If you've ever had any troubles with constipation, chances are you suck. And we can teach you to become better and better at that. And that's been something that we've taken on, rather than having the mindset of, hey, women have babies all day, every day. Millions of women have done this before you. It's like, hey, this is a skill set that we can develop. So, let's work to develop that. Let's think of it much more about riding a bike than you're just going to be born like this. We have to practice and learn to crawl. We have to practice and learn to walk. We have to practice and learn to ride a bike. Why do we think that we're just going to be able to have this or go through this massive physical challenge that our body has never done anything similar to and think that we're just going to nail it first time around? We can teach you those skills. We can teach you how to push. We can teach you how to relax your pelvic floor. We can make sure that your pelvic floor is getting ready to be able to birth, that you're getting really nice stretch, really nice engorgement and movement there. So that's sort of what probably our main body of things is moving into in your antenatal space, as well as we're now running Better Births, which is birth education. It's a hybrid model where the majority of your content is online, really valuable content, really deep content into like a bit of the science, and then how that carries over into practical like tips and tricks, everything from pain management strategies, and like physios are pain scientists, we work in pain, so I guess it's really natural that this has come to us. So much more than just your pharmacological pain options, like pain management strategies, acupressure points, distraction strategies, mindset strategies, all these things to help you be prepared and cope with labour, as well as then positions for birth, positions that are going to maximise or prioritise pelvic floor integrity as we move through that. So there's so much, but that's all about, I guess, our antenatal.
Better Birth as well. So you've got your online modules, and then you'll come here for a face-to-face workshop with one of us. And so that's an hour and a half, 2 hours face-to-face. You bring your partner with you, because we know it's actually a lot about them as well, and how much they're protecting that space and advocating for you as well. And then we work through those practical strategies. So again, it's not the first time I'm doing this, is as baby's coming, we've actually practiced this. It's not a brand new skill there, which is going really well.
Amazing. And how often are you running these classes as well too, for the labour prep, birth prep?
So the Better Birth, Born Ready.
Born Ready Better Births.
Yeah, Born Ready Better Birth. So you can do the online modules like at your own pace, and then the workshops, we're aiming to run them roughly every sort of 6 weeks. So we'll picking up people as they go. We also offer in here, if the group thing's not your vibe, is we have birth prep like appointments one-on-one. And so we work with you from that 34-35 week point. It's directly based on you and your preferences and your situation. So the online component, it's for birth. There is section or a planned C-section as well. So it's not just aimed for vaginal births. And then there's plans in there in case it does go the other way as well. So like that online component will cover part of that.
Do you research, and everyone does? You know that private birth classes, birth education outside of the hospital is so much more beneficial. It decreases labour complications, decreases your expectations, so you get a smoother, calmer birth that you wanted. So we love that you're doing your own education courses.
And then postpartum, it's all about rehab. It's all about what happened, what's the integrity of the pelvic floor like, what's the function of the pelvic floor like, and what do we need to do to get you functioning again. I really want to shy away from saying normal, because really you have a new normal, but we still need that to be a functional normal and not a dysfunctional normal. And then also to make sure that we can see whether there's any risk factors for developing anything in the future, so that we can ensure that that's not the case. Majority of what we do is, and we'll always start with a one-on-one consult to begin with, an initial consult. Our birth prep classes, we're running the workshop for the content delivered by Born Ready.
Yeah.
Whereas internally here, we start with an initial consult, and then we kind of filter through from there, and we'll decide your treatment plan.
Yeah.
So during that initial consult, if it's the priority that's popping up, we will do a full pelvic health check. Sometimes it's not indicated straight away, but we have other tools there, like our real-time ultrasound, where we can have a look at things without sometimes the anxiety that might come with us being like, so now we're going to do a vaginal exam, and you're like, oh, I wasn't expecting that. Don't want people to feel like that's all that we do. We can assess the pelvic floor, bladder function, bowel function in so many more ways that are much less invasive if you prefer to start there. Sometimes, where with certain things we're possibly going to encourage you and be like, oh, I really need to check this out. But, by that time we've had a chance to develop rapport. I don't want people to feel like, oh, if I go there, I have to do a vaginal exam. There's so much we can do prior to that, if need be, if you're not feeling like you're up for that right now.
Yeah.
Most of us, once you've had a baby, you literally,
sure.
But so we would do a full vaginal exam, as well as postpartum. We do a lot on the abdominal wall as well. So we do a lot of, examination of like your abdominal separation, the function of that, and then whether those the abdominal wall's working optimally. It filters really and works really closely with your pelvic floor, so, and obviously is affected a lot by pregnancy. So that's sort of where we start with our postpartum. The other consult that we have started up as of the start of this year is actually our telehealth consult within that first week of birth.
Yeah.
So we were finding we're getting so many of our women at 6 weeks, but there's a lot of hormonal change and then a lot of recovery that happens in that first 8-week mark. You birth your placenta, your hormones plummet through the floor, particularly your estrogen, you start to firm up. There's a lot of things we want to do to ensure that when you firm in an optimal position, really. So we've started to offer a telehealth consultation, meaning just give us a call. We will call, book an appointment. And we'll chat to you. And I have so many of my ladies that call me and they're like day 2 and they're still in the hospital. They're like, hey, just hold tight, we're bathing baby. And we get to debrief from their birth experience and get really targeted acute advice so that we know once we see you at either 3 weeks for abdominal rehab or 6 weeks for full pelvic floor check, that you have ticked so many boxes already. I don't like to say we've missed out on recovery because we haven't, but if we can get to you and optimize those first 6 weeks, it makes such a difference.
We've given birth and we've called you at the 6-week mark. Difference between C-section versus natural birth. I feel like we're talking a lot about natural birth, but I feel like a lot of trauma changes do happen in a C-section as well. So do you offer anything, or have you done a lot of cares for C-section birth?
100%. It just focuses much more, it eventually focuses much more on abdominal rehab, but we check the pelvic floor anyway. We actually tend to find quite a lot of overactivity in the pelvic floor post C-section, because it's like, hey, you've got no stability from your abdominal wall and your abdominal muscles, so something's got to take some load and work really hard. So they really do interplay. Either way we do pelvic floor and abdominal wall rehab, it will just probably change as to what the priority is at the time for your body, but that does anyway for every individual consult. So probably the biggest change is if you are planned Caesar, you don't have to worry about your pelvic floor birth prep. But everything else we need to follow through anyway.
And I mean, a lot of the time it's that unplanned C-sections. You've gone in with this is
hopes and
this is
dreams.
this is my pathway, and it hasn't quite eventuated.
Mm-hmm.
And so often, there might have been something underlying with the pelvic floor that's what sort of bumped you off that pathway, and that might be where we can jump in, and then you can potentially get that really restorative VBAC after, and you get the the birth that you'd hope for in the first instance. We do get a lot, I feel.
Definitely aiming for a VBAC, I think, is probably one of the most important times to see us. We can usually work our way backwards and be like, okay, what did and didn't happen last time, and we can assess, and a lot of times, be like, this would have been a barrier.
And even scar management as well. So the C-section scars always, just a mission from the start as well. So we can help with the just scar tissue management and mobilization as well. And even just like moving around, like you had your abs cut into, and you don't realize how much you use them until you can't. So even just strategies around just to make it a little bit easier, because it's hard enough as it is. Just little tips and tricks in there. And then our individual appointments, it's based on you and what you're wanting, your situation is. And we tailor that. Like, there's no point me saying, well, we need to go and do cartwheels down the street. No, that's not my vibe. So it's based on you, your situation, and what's going to work best for you. So we're very much working like with the person.
And what your assessment has told us as well. So we're not going to work on something that's completely functional and it's a tick box. We're going to gear our treatments towards the things that didn't work and the things that aren't functioning as well as we'd like them to. And the problems that pop up. So all based on that individual assessment.
And giving the reason, some of the why and the what, and which you sometimes don't get. With other sort of medical professionals, we don't have time for that. Whereas we have a bit more time. We can answer your questions. There's a bit of less pressure. You're not being like, you walk out and, oh God, I didn't ask X, Y, Z. And so we can, work with what you want to know and need to know and all of that.
We always used to laugh at our mums on the trampoline peeing themselves, to be honest. It was like such a normal thing, and now we're looking back and it's like, that is not normal. That is something that we need to correct and fix and everything. So when we're moving on to our later stages of life, is it too late? Like, do you know what I mean? Like, 3 kids down, nothing's working down there like it should, kind of thing.
No, absolutely not. So, majority of there's certain things that we will, like a prolapse, and there's a fascial defect. We can't fix that. Surgeries can, or we can use pessaries to help support that. But the main thing that we work on is muscles. Like, your 80-year-old grandma can build a muscle, can recondition a muscle, can strengthen, can bulk, can tone. Like, muscles don't have an expiry date. So 100%, it is never too late. If something popped up and you waited ages to have it seen to, would it be a longer journey back? Yeah, absolutely. But can you still make your way back? Yes. 100%. It is never, ever, ever, ever too late. And we have so many things that pop up, so many symptoms that pop up, again, particularly in and around that perimenopausal, menopausal age. And there's a lot of hormonal influences there as well, and that's why those kinds of conditions can pop up, like your urine leakage. I have so many of my perimenopausal women that and then postmenopausal that are like, I didn't have this. I've never had this. What the? How did I get through all of my babies without this? And now this is coming. But there's so many factors why, and then particularly as you get later on in life, like generally our muscle strength does decline, but that we can rectify that. Does it decline quicker postmenopausally? Yes, but again, we can't rectify the hormonal changes, but we can develop that muscle quicker and quicker. The same with your bone density. Like, if we have, I know we're going out to more of our pre and postpartum mums, but if we've got someone that's got problems with bone density, your bone's being reabsorbed quicker, yes, but guess what? You can create bone. We can stimulate a bone production just as quick and ideally quicker than what it's reabsorbing. So these issues that come with aging, I probably for you to challenge those as opposed to anything else. So our body is extremely robust. It is not as delicate as we think it is, and the decline isn't definite. We've got a huge bearing over that. So it's the same with our pelvic floor, so it's the same with our abdominal wall, it's the same with anything that pops up postpartum. There are certain things that you might be more at risk of, but we can manage those as opposed to fix. It's not always a fix, but there's so much you can do.
I think when we also look at the broader evidence base around it, so many times physio will come in as like the front line. It should be the first option, and particularly in pelvic floor space, we outperform so many other interventions, and it's low risk, when minimally invasive, and it is successful a vast majority of the time
for a vast majority of
people
and symptoms. Incontinence, whether stress incontinence, urge incontinence, we're talking pain with intercourse, we're talking pelvic pain, persistent pelvic pain, we're talking like fecal incontinence issues, but then the other way as well, like constipation and difficulty actually getting rid of your stool, hesitation with urine, we're talking prolapse, we're talking heaviness in the vagina. Like there's so much that we're specifically speaking about there, that yes, we are first line, front of line, should be working with you if there's any issues with pelvic health as well. Even when we talk, there's so much around at the moment about like your medical gaslighting and whatnot, and I think we need to be a little protective of some of our health professionals too, that if they don't know, they don't know, and that's where you need to find the niche or the health professional that does know. So yes, do we like to think that our GP knows absolutely every little aspect of the health world and the health industry and know exactly where to send you? Yes. Is that really possible, and is that a realistic expectation? I really don't think so. So as much as it might not have triggered them to go down further investigations, that is where we do need to jump in and advocate for ourselves and be like, oh, okay, well that must not be their forte. Take that perpetual optimism type view of things and go, oh, maybe not for me, let's move on. I don't know that anybody would be sitting in a health professional role if they didn't genuinely have the patient's care at heart, but maybe they're just not the right fit for you, and that's okay. Go look elsewhere.
I think as well with the modernised world in birthing and labour, you don't see it anymore. Like, you don't see your sister giving birth or mum giving birth or anything, so you don't know these complications, and then you get to your mum group and you go, oh my goodness, something's not right, my bladder just doesn't want to hold itself, kind of thing. And then you say that to a group of women that are like, oh, I don't know, and I don't have that, so I don't know. It becomes a very shut off world, and you go, okay, well, nobody seems to know, so I'm just going to keep it to myself, surely it'll fix itself and everything. So that's why reaching out, and I think not being so private, sadly, this is not a private matter.
But it's hard, like people do find it embarrassing. Like, I mean, we work, so it's our bread and butter. For us, it's just another function that the body has to do. You'll see a speech path because you can't form your words or your sounds or swallow or something like that. For us, it's just the other end that's not working properly, and we probably do need to whatever the word is, destigmatize all of that and realise it's just a bodily function. We all need that bodily function, and sometimes it doesn't function, and we just need to talk, be open about it as best you can, and kind of challenge your own biases in that instance, I think, and challenge your own hold-ups. Like, if someone's coming to you and they're saying these things and you're pulling away, well, that's probably something that you need to lean into.
Some common presentations that people probably don't think to come to.
Well, even mastitis, we've got emergency appointments available. Like, if you wake up and you're like, oh no, call us, message us, we will fit it in. We use therapeutic ultrasound. We can talk you through the changing guidelines as well, because that's still relatively recent. Help you navigate that, because again, there's a lot of questions around, well, do I, don't I, what do I do, and how best guess, to get you through, and also let you know when, you do actually need to go and see a GP and get a script for antibiotics now, or we're going okay.
You've all doom scrolled at 3 a.m. when you have like a sore breast, but there's so much information out there that you can't quantify, like you can't qualify, like you don't know where it's coming from, you don't know who's giving it. When you're always going to get evidence-based here, and this is an area that both of us are so passionate about, that you're always going to get very up-to-date evidence-based. So you can kind of rest assured with that, rather than trying to navigate something and go, I saw these two things but they were both kind of different, now I don't really know which one to do, or I saw this but someone said something different, and now what's the right thing? Like I do think like there's so much information that you can access, but when it comes
even what we were telling people, 3, 4, 5 years ago has changed. So things that you've been told by health professionals is not we've engraved this in stone and it's now what we live by. It's a constantly evolving base, and we learn more and we know better and we do better. So if you had something from a couple of years ago where you're like, well, that was
what I did for my first child, or my fourth child.
And it doesn't really work for me, but that's what I was told I had to do.
Appointments. Obviously, you're a privately practicing physio, so there is an appointment price, but is it Medicare covered, healthcare covered? How do you go around that?
I think probably the hardest thing for us is because we have so many options. So as much as we're trying to ease that load from you, I get it can seem overwhelming. Like, yes, you can come in as a private paying patient. You can claim on your private health insurance if you've got that. There's options as well through a GP for, they call chronic disease management plan. So if you've been suffering with something for 3 months, it is chronic. And you can get a referral for some rebated sessions from there as well, and that's our one-on-one appointments with physios, as well as we offer like group rehab as well. On top of that too, we also have our Pilates studio, so we offer reformer Pilates. We've got mums and bubs classes. We have our like on-demand kiosks, so you can come in at 3 a.m. And do a postnatal class, because this is the only 40 minutes that Bumps is actually asleep in. You can come in and do that. We also have some of our lovely instructors available for some one-on-one.
The mums and bubs, what's mums and bubs include kind of thing?
So we run those classes twice a week. We've done pre and postnatal like training for our instructors for those classes. So we just meet you where you're at. They're always happy to baby hold. It's the highlight of our week is a bub that just does not want to be put down. We've got plenty of arms.
Oh no.
So yes, bring baby in. We're rocking and carrying and all of the jazz, and we just take you through a class that's trying to target the things that we would talk to you about in a postnatal rehab anyway, and just getting you back in the groove. You're in a group, there's other mums there, you can bond, you just get out of the house.
Yes, correct.
If you just come in and go, I'm just going to lay here, I'm like, fine, go for it. Absolutely.
And that's all the things that are protective for your mental health in this space as well. You're exercising, we know how great that is, you're getting out of the house, you're socialising. It can literally be a saviour after you've come off no sleep.
Particularly, like I think I think where we spend so much time in that newborn, like there's so much change there. But I even know personally for me, it's like the help goes away, and now like, oh, you've got this, and it's that 6 to 12 month bracket is so hard.
Yes.
It is so hard.
And you find yourself in the same routine of every single day, doing the same thing in the house.
And yes, they're cute, delightful cherub, and they're sitting and they're amazing, and you are just like, this sucks. So you can come and do Pilates, and just get out and do something for you. I think we are all terrible at just spending time on ourselves. And I think
that's the biggest predictor of a child's success is the mum's happiness. So, even we sometimes find it hard to throw the attention onto ourselves and the priority onto ourselves but you're actually prioritising their overall success and well-being by you looking after you.
Why don't you recap common conditions that you are seeing in the clinic?
We start with leakage. So you've got either bladder or bowel leakage, even like farts, gas leaking, as well as things that we can help with. Whether that is from sneezing, coughing, you know, jumping on the trampoline, going for a run, or, you know, as soon as that key goes in the door at home, I am legging it to make it to the toilet in time. So we've got like our incontinence from there. You know, if you've got concerns around prolapse, even before you've had kids, it's also a possibility as well.
People don't realise how much birth increases your risk of prolapse.
Yeah.
So it is very, very high after just one child, let alone two. So
Yeah, and
It's also though not the cause.
yes,
It's a trigger.
Correct.
So there's other things that can be leading to that. So just because you haven't had children, if you are having heaviness, if you are having a bulge, feeling something when you wipe that's different, you know, you need to come and see us.
yeah. So prolapse concerns as well. Personal favourite of mine is like all things bowels and gut health. So if you have difficulty with constipation, if you've got irritable bowel syndrome, if you feel like on the Bristol stool chart you're everything from type 1 through to type 7, please come and see us, because there's a lot we can do in this space, regardless of whether you've had kids, thinking about kids, or couldn't think of anything worse. There's a lot we can do in this space and how it affects a lot of other conditions as well. And then we move on to more of your sort of medicalized conditions, I suppose. So your endometriosis, there's some really good research coming out that, again, physio is part of that frontline treatment team for your endometriosis, your adenomyosis, even your polycystic ovarian syndrome as well. If you're getting any pain with using menstrual products, with intercourse, with having a bladder or a bowel movement as well, that's absolutely areas that we can jump in and provide some assistance. Yes, you're not crazy.
Body hormones.
Perimenopause especially kicks in way earlier than I think we give it credit for. And so those, just everything aches and niggles, and like the inside of my ear is itchy. It's hormones. And there's absolutely like things that we can do to help with that, and even just to reassure you that no, you're not hysterical, you don't need to be institutionalized. There is
to help navigate the system in that instance, because it's an area that really is just getting a lot of recognition now. You know, they're recommending that you see a menopause informed GP, so we can help you to navigate that system. We can just first of all reassure you are not crazy. No, we're not sending you to Banksia. We're going to find somebody who can help you. So I find that's a really big thing that we do in that population as well, is like, okay, this stuff is under our umbrella. This stuff, we're going to send you here, here, or here.
Okay. Amazing. I think that is us all finished. Thank you so much for your time. I really appreciate it. All the questions you've answered amazingly.